Today, let us talk about palpitations. What are palpitations? Normally, we are not aware of our own heartbeat. The unpleasant awareness of one's own heartbeat is palpitations. Before we jump into palpitations, let us take a peek into our own heart. Our heart is nothing but a pump with 4 chambers. 2 on the right, 2 on the left. The upper 2 chambers are the atria or the receiving chambers. These receive blood and pour down into the ventricles. Now this pump requires a signal for heart, and this signal comes from the right upper chamber known as the right atrium. So the signal for the heartbeat starts from a point in the right upper chamber known as the right atrium. It travels down to the junction box and between the 4 chambers and then splits into 2, one for the right and one for the left. Our electrical wiring system of the heart is so perfectly fine-tuned that it can pump or it can generate signals without the help from the brain. Actually, heart is the only organ in our body which does not require control from the brain. To give you an anecdote, you would have seen the movie Pirates of the Caribbean. You would have been amazed at the pirate captain Davis Jones' heart beating inside a chest which he has buried in the sand. It is possible, though not entirely in the same way. Our heart is able to generate its own signal. This is why cardiac transplantation is possible. Now, coming back to palpitations. So with this basic understanding of the heart's pump, we look at what can cause an abnormality of the heartbeat. It can be simple due to stress or anxiety, or it can be quite complex related to the short circuiting in the junction box or an irritable point in the heart which is beating fast. To give you a few examples, if there is abnormal signal generation from the normal point from where signals are coming, it is called sinus tachycardia. It is usually benign or not troublesome. If another point adjacent to it or somewhere else in the atria is beating fast, we call it atrial tachycardia. Now, if there is a looping of the signal within the heart, it is called atrial flutter. If there is chaotic beating in the left upper chamber, it is called atrial fibrillation. If an irritable point is beating from the lower chambers, we call it ventricular tachycardia. If there is a short circuit within the junction box itself, we call it a reciprocating tachycardia or a re-entry tachycardia. It is very important for us to determine what is the cause of this tachycardia, to target treatment against it. So, it is very important to get an ECG during the event or when you are having the palpitations. Sometimes it is not possible to get an ECG recording done because the duration of tachycardia or palpitations is very short, sometimes lasting for a few minutes or maybe half an hour. So this is when investigations like Holter or loop recorders come into play. So my advice to you all is that if you are having palpitations, try to get an ECG done at the earliest and give a visit to your friendly neighborhood cardiologist. We take a pledge, we'll treat you well.